more on this, Dr. Hans Kluge joins us from Moldova. He's a public health expert and the Europe Regional Director for the World Health Organization. Hans, we understand that you just got back from Ukraine. What did you see there? What has stayed with you?
Well, I'm leaving definitely with a lot of impressions. First and foremost, yesterday I think was the most difficult day. We spent quite a bit of time also in the underground bunker because of the continued attacks. We went actually to a major hospital where the surgeons were doing very important surgery, and they had a blackout. They were going to run out of electricity in 3 hours, and we were just on time to provide a generator so the surgeon could continue with the life-saving operations. But then if you realize that 50% of the civilian energy infrastructure is down, and the winter coming, a brutal winter, now it's about the temperature hovering around 0 degrees Celsius, but it will plummet to -20 soon. It means that millions and millions of Ukrainian people will really be under threat. Also in the recently liberated areas, it's an elderly population, not so mobile. We spoke to volunteers who just returned, for example, from Kherson, some of our own people from WHO as well. All primary healthcare facilities destroyed, all pharmacies destroyed. So even for chronic disease like hypertension, people are going to pass away, plus the cold, heart attacks, stroke, respiratory infection. But the positive is, I am so impressed by the resilience of the healthcare workers. I mean, the doctors, nurses, staying, saving lives despite of the bombing. So it was a big lesson for me as a medical doctor in humility.
So what is the WHO's involvement there? What are you able to provide or organize to help that situation?
We are working on a dual track. We shouldn't forget we have been here for decades. So we had a basis, but we doubled and tripled our staffing. 200 plus staff in 7 locations, as close as possible to the front line. So one track is the direct humanitarian assistance. More than 1,400 metric tons of life-saving supplies were shipped where and when needed. The priorities change, and we do it coordinated and guided by the Ministry of Health. Now also generators, fuel, etc., but also trying to continue the very important health system reforms which were started about 10 years ago, for example, on health financing. Because yes, we need humanitarian support, but let's not forget that Ukraine has a strong public service which the international community should help to prevent collapsing. It means budget support for salaries and for medicines.
You know, Hans, I want to ask you, have you covered similar situations in Europe in past wars? For example, in the Balkans, were your doctors there on the ground as well? I want to get at, is this normal for this much of a country's power grid, for example, to be targeted, for hospitals and pharmacies to be blown up? Have you seen this before in past conflicts?
We have seen, but I would say not on this scale. Until recently, WHO had documented 704 attacks on healthcare, ambulances, healthcare workers, objectively documented. But now, with this complete blackouts, we can call this the largest attack on health systems on European soil since the Second World War.
And I know that you are also concerned about the grain issue and getting food products out of Ukraine, because other countries' people are going to be facing crisis too because of this war.
Absolutely. And I'm going actually to Ankara to meet the Minister of Health, Dr. Fahrettin Koca, a really also a very strong health leader and supporter. And I want to thank the ministry. I want to thank the President of Turkey for the enormous mediation role in the grain deal. I mean, 22 million people in the Horn of Africa only could be pushed into famine without this grain deal. So I really would like to further request this international leadership, the mediation, because ultimately, I always say, the best medicine is peace. We do need peace. This war has to stop.
Hans, we want to thank you for the work that you do and for bringing us your insights and your experiences from there. Thanks very much.